7 workers at a Florida bar and a group of 16 friends who were out for a night of fun all tested positive for coronavirus. Erica Crisp was one of them. She's been sick for a week, but she's here along with 2 of those friends, Kat Layton and Dara. Is it sweet or sweat?
It's sweat.
All right, good to have you. Now, I don't want any of you to sweat. This is not one of these sessions. I'm happy that you are feeling better. You're young. Thank God you didn't get hit the way I did. I just wanted to quickly give each of you a chance to share how you now feel after this experience. Erica, starting with you. I know nobody had masks. It was crowded in there, just like a normal bar. Why did you think it was okay to do it that way, and what do you think now?
I think at the time it was more out of sight, out of mind. We hadn't known anybody who had it personally. Governor, mayor, everybody says it's fine. We go out. It's a friend's birthday. It was a mistake.
How do you feel about it now? You say it's a mistake. What do you want people to think?
I feel foolish. It's too soon. Clearly, we got super sick almost immediately within days. So I feel.
Hey, look, the most effective preacher is a convert. Now you can tell people, I know why you think it's not a big deal. Learn from me, at least from now. Thank you for coming forward and doing this. I know this is not how you wanted to make your debut on Cuomo Prime Time, but thank you for doing it. Kat Layton, you were there as well. You had a little different set of symptoms. You were of that no smell, no taste variety. How are you feeling now, and how has your perspective changed?
I'm feeling fine. I really am. It is very bizarre to be able to breathe in but not smell, your favorite things. But it kind of feels a little spoiled to complain about things like that at the moment. But my experience is definitely that, of course we're regretful. We do feel foolish standing there in front of all those people. We knew we were pushing it, and it's a little overwhelming, I think, to kind of be ahead of this, but really we just want to raise awareness. We want to get ahead of it and tell people that, it's really not ready for what we thought it was ready for. It's too soon.
When you realized, Dara, that you weren't feeling well, what went through your mind?
There's a global pandemic going on and I feel sick. I was a little scared, a little nervous, and receiving the text message that my friends were just boom, positive, boom, positive, boom, positive, back to back to back was almost a little overwhelming.
Did anybody get sick?
Not to my knowledge. I think all of our symptoms were fairly mild. I do believe that 1 or 2 of us had flu-like symptoms and were kind of like laying in bed. But for the most part, I experienced very mild symptoms throughout the entire time.
Like 4 or 5 days worth, and then it started to get better?
Yes, sir.
Yeah.
Erica, I know that it was a group of 16 of you. Everybody got sick?
Everybody, every one of us.
And did you hear stories about people who weren't part of your group getting sick there? Does anybody believe it was something about that place, or you think it's just doing too much too soon?
No, yes. I've been, since this all went public a few days ago, the local news, I've been messaged, inboxed by strangers, complete strangers that were there that same weekend, Friday and Saturday and Sunday, who are now very sick. So it wasn't just our group, it wasn't just us, but there was one place in common. It was the only place we went to, so.
They chant his name, and the sirens wail. This is a tribute to Dr. Miguel Angel Perez Alvarado, a doctor who worked in a public ambulance in Mexico City. He died last month of COVID-19. For weeks, the father of 3 girls treated patients with the virus. He was worried, his wife Nancy tells us, because he knew his working conditions weren't safe. Dr. Perez told her he wasn't given the right protective equipment on the job, and he's not alone. 7 paramedics and a doctor who work in public ambulances told us the same thing. Here, one demonstrates how water can be sprayed through the coveralls they've been given. Duct tape is now important. They use it to patch holes in their suits and to tape up garbage bags to try and isolate COVID cases inside their ambulances. Speaking anonymously for fear of losing his job, this paramedic says he and his colleagues had to buy their own safety equipment. He says they're sending us into a war with nothing. You don't send a firefighter to a fire without protection.
So this is the mask that the paramedic we're speaking to says the government issued him, and you do not need to be a medical expert to understand that this does not give him the kind of protection he needs.
The paramedics we spoke to work for two sections of Mexico's health ministry. Both sections said all their paramedics have the required supplies, statements that seem to be demonstrably untrue, especially when you see how it's supposed to be done. We spent the night recently with a Red Cross ambulance crew, private volunteers who have all the right equipment and even designated COVID units. And that's a necessity because the worst of Mexico's epidemic is happening right now. On a 12-hour shift, there were 12 COVID calls. And sometimes we were too late.
So we got this call a little over 20 minutes ago now, and we just arrived on scene. And in that time, the 43-year-old female victim had already died of symptoms consistent with COVID-19.
And arriving with patients still alive didn't always matter in the end. 72-year-old Maria Isabel Cruz Hernandez was taken from her apartment and brought straight to the hospital. Her son told us she has since passed away. After each exhausting call, trucks and paramedics are both sprayed head to toe with a special disinfectant. Paramedics in government-run units say they try and disinfect too, once again, with supplies they bought themselves.
¿Tienes miedo?
Are you scared, we ask? Always. He says you don't sleep. Scared for myself, scared of infecting my family, and scared of ending up like Dr. Perez. 2 days after he went to the hospital, he texted a final message to his wife. He said, "Be careful. I love you all." That was the last time we spoke. 8 days later, Dr. Perez passed away. Matt Rivers, CNN, Mexico City.
It's not like you haven't heard this before. Health officials urging everyone to get a flu shot. But the director of the Centers for Disease Control and Prevention says now is especially important to be vaccinated against the flu. Dr. Robert Redfield says if a second wave of coronavirus hits when the flu season is underway, it could really strain hospitals. But if more people get their flu shot, that could ease a potential strain on resources. He says only about 47% of Americans take advantage of the flu vaccine, but he's hoping the public will see it's a major way they can help this nation get through the fall. Not all flu cases are reported, but the CDC estimates that from October 1st, 2019 through April 4th, 2020, there were up to 56 million cases of the flu with up to 62,000 deaths. While the flu is detected year-round in the U.S., flu viruses are most common during the fall and winter. For today's Health Minute, I'm Mandy Gaither.